Okay, so here's our review for muscles, part one, head, neck, and chest. This is our list of muscles here. We've got major muscles of respiration, facial expression, and mastication. Mastication is going to be chewing. And then we have muscles that move the head and vertebral column. So here is a good picture here of some of these superficial muscles of the syndaver. And so you can come back to this as for a reference as we go through in order to look at all of these. Here are the posterior superficial muscles. Again, you can use this as a reference to come back. All right, so muscles of facial expression differ in that they insert into the skin or the face or maybe another facial muscle instead of bones. So it's a little bit different than how some of the other muscles are going to be. Okay, so when the muscles contract, they do not cause movement of a joint, they instead cause movement of the skin of the face. All right. So the muscles originate on underlying skull bones or in the superficial fascia. Or hypodermis or subcutaneous tissue, and then they go through the superficial fascia and insert into the dermis or other facial muscles. So here these numbers represent numbers on the models. This is one of the models that we have, so you can also use this in class to find these particular muscles here. Okay, so here are the superficial muscles of the face. This is another good reference slide here for the syndaver, so I've incorporated these. You can see the muscles here aren't quite as, you can't see the circular rings on this picture quite as well as you will be able to in lab, in person, okay? But also you can see them on the other models really well. So be sure to look at both and the location of these. And there are a lot of muscles, so you want to make a list or get your list of structures to know. Divide that out by how many days we have before the exam, and be sure that you learn all of these, okay? Particularly pay attention to those if you need to differentiate between them where we have a lot of muscles. Pay attention to their origin insertion, and that will help you to differentiate between which one is which. Another good reference or overview slide to put in here, okay? That's the purpose of having these in here, so that you can use these as a reference during lab. All right, so here we go. We're starting with muscles of facial expression. Be sure that you also pay attention to the movement. I would recommend during lab that you actually go through the movements. I'm going to put the lab manual for the syndaver on Blackboard, and then of course there are other places you can also look that will tell you the movement. If you will actually go and make the movement during lab, as much as you can, if it's flexion or extension, if it's extension, if you're raising the eyebrows, that sort of thing. That's going to help you to put that kinesthetic, that movement into your learning, which will help you to learn them better and to remember them better. All right, so another thing I failed to mention is that I do have a list of what the names mean, okay? And we do have a little PowerPoint somewhere I'll probably do in class about how to study muscles, and that the names mean certain things, like it might tell you the shape of them or their location, okay? And so orbicularis oculi of course refers to the eye, and orbicularis means little circle, okay? It comes from Latin, I believe. So little circle around the eye. So that basically tells you what it is, okay? And so the function here is to close the eye, squint, and blink, okay? The origin is on the frontal and maxilla bone, and the insertion is the skin around the eye and the eyelid. All right, you can see here some of these pictures in APR are really very handy because you can see really well. We're talking about this muscle, okay? And then here's one of our models, and then the one on the syndaver. So be sure that you learn this in all areas, because I could test you in any of these ways. Next here we have the Buccinator muscle. This is also sometimes called the trumpeter, now not officially as a scientific name, but the trumpeter muscle, because this is the muscle you use when blowing a trumpet. This pulls the corners of your mouth laterally and presses the cheek against the teeth. Buc means cheek. The origin here is going to be the upper maxilla and mandible, and the insertion is going to be at the angle of the mouth, at the orbicularis oris. All right, so here we have the occipitalis. This is, if you've learned your skeletal, you know the occipital bone is back here at the back of your head. This is sometimes listed as one muscle, as the epicranius, with two bellies or two parts. And those are the ways that I want you to identify them. You can put epicranius, but if you don't put frontalis or occipitalis, you are going to lose points, okay? And so occipitalis is going to be here at the back of the head. Most show it as the two muscles because it's bilateral, and like in this case, let's see if I can get my little pointer to show. In this case over here, you can see it's shown as one, but it's on the occipital bone. So as I told you before, you're going to see a lot of things that are named similar to skeletal. Now, not everything. Some things are based on shape or how many bellies, so to speak, that they have. And so these two are attached. We have frontalis here in the front and occipitalis in the back, and they're attached with the aponeurosis, which is a whitish-looking connective tissue that acts as a tendon for muscle attachment, and this one is the epicranial aponeurosis. Okay, then we have the occipitofrontalis. I'm sorry, sometimes you'll see it called the occipitofrontalis. So occipito back, frontalis front. And this is going to move the scalp posteriorly for the occipito and elevate the eyebrows. So occipitalis, I'm sorry, I'm using different terms and it's really the same thing, but I want you to use occipitalis. It's going to pull the scalp posteriorly, elevate the eyebrows, and it's here. All right, so here is the frontalis, and you can see this is also bilateral on both sides. It's two muscles at the front of the head, all right, and these elevate the eyebrows and wrinkle the forehead. Next, here we have the mentalis. Mental means chin, so remember you have the mental foramen, right, from skeletal, and so mental is here. So these are paired chin muscles. These elevate the skin of the chin and form kind of a V shape. You can see that really well here in this picture. This causes a protrusion of the lower lip, kind of like if you're pouting. All right. The origin is going to be the anterior medial mandible. And the insertion is going to be the skin of the chin below the lower lip. All right, here we have temporalis, which is appropriately named because it is near the temple of the head. It is a fan-shaped muscle here. Let me fix my little pointer. You can see that it kind of has a fan shape over here. The function here is it is going to elevate the mandible, and you can see that it is attached here. So it's going to elevate the mandible. The origin is on the temporal fossa, and the insertion is on the coronoid process and the ramus of the mandible. All right, so here we have the Orbicularis oris, which means little circle around the mouth. So it's like the portion here on the eyes, except this one is around the mouth. The origin is on the maxilla and the mandible, and the insertion is going to be the skin and connective tissue of the lips. You can see it's a circular muscle really well on this model. It's a little harder here, but when you look in person, you'll be able to tell. All right, so here we have the masseter, which literally means chewer. It is one of the muscles, or the main muscle of mastication. You can see it right here and right here. The function here is to elevate the mandible and close the mouth. All right, so if your mouth is open, you want to close it, you're using the masseter. Just like you're chewing, right? So the origin is on the zygomatic bone and the process of the temporal bone, and the insertion is on the angle of the mandible. All right, so here we have platysma, and this is to me one of the more interesting muscles. It's a broad sheet of flat muscles. Platysma means flat plate, and it comes down like this. This draws the corners of the mouth down and okay, so it also aids in depression or maybe down of the mandible. All right, so here we have the zygomaticus major. We have two of these. We have the major and the minor. So the major is going to tell you it is usually going to be the larger one. All right, and so this is the major right here, and then this is the minor right here, okay? Be really careful in APR when you're looking at these and pay close attention to which one is which because they are very, very easy to mix up, okay? So the greater muscle of the zygomatic bone, this is what we're looking at, is going to elevate and draw the corner of the mouth laterally, okay? This is sometimes called the smiling muscle. So the origin here is on the zygomatic bone. The insertion is the skin and muscle of the corner of the mouth. All right, so here we have the zygomaticus minor. So major here, this is a little bit easier to see picture. Minor here, major here, minor here. So the minor one is on top. Major here, minor here. So don't mix these up, okay? Be sure and pay attention to these. All right, so here we have the medial pterygoid, the P is silent, pterygoid muscles. These are wing-like. That's what pterygoid means. You can see we have medial, lateral, and superior pterygoid muscles, okay? So superior means above, so it is the one above. That's the superior belly of the lateral pterygoid. And then we have the inferior belly. Here, inferior meaning below of the lateral pterygoid. And you can tell this one is laying, these are lateral, and this one is more horizontal. So up and down, is that horizontal? Vertical, sorry. This one's more vertical. And so here's the medial pterygoid, okay? Remember, medial and lateral. This one is going to elevate and protract the mandible. All right, so here we have the lateral pterygoid is going to protract the mandible as well, help to open the mouth, and it's active in grinding and chewing. You ever grind your teeth? Maybe these weird faces I'm making will help you remember this stuff. All right, so we're moving to more of the muscles of the body and trunk here. Here's our syndaver, and she is showing us, and yes, this is she is showing us the superficial muscles of the anterior trunk. All right, so here you can see the deeper muscles of the posterior neck and the upper torso. So it's important to remember that these are in layers, and so you need to pay attention to which ones are more superficial and which ones are more deep, all right? This is a really good comparison slide because you can see here on the left the more superficial muscles, epicranius, trapezius, supraspinatus, deltoid over here, infraspinatus, let me get my pointer back up, latissimus dorsi, okay, and then you can see this serratus and obliques, erector spinae muscles, all of these more deep muscles here. So use this as a good reference point. All right, so here we have the sternocleidomastoid. And so this one basically tells you where it's at, all right? So it looks flatter over here in this picture than it does right here. I really kind of like this one because to me it's very obvious. I have very tight tendons and muscles in my neck because of some issues, and I know that one bothers me all the time. I can really feel it. It's really thickened. So the sternum, clavicle, and mastoid, that's what sternocleidomastoid is referring to. So these are the muscles of the sternum, clavicle, and mastoid. So this draws the mastoid process down towards the same side, okay? Mastoid process down towards the same side, which causes the chin to turn up towards the opposite side, okay? And so these all act together. The muscles of the two sides flex the neck, okay? These are strap-like muscles. Again, sterno is because of sternum, cleido is clavicle, and mastoid is going to be the mastoid process. The origin is going to be the manubrium and the medial clavicle, okay? So the middle of the clavicle. The insertion is going to be the mastoid process of the temporal bone. All right, so here we have the trapezius. This is what we call a table-shaped muscle, okay, table-shaped. They think it's shaped like a table. I don't really see a table, but, you know, they have to use their imagination for some of these. It's really more diamond-shaped. It's trapezium or diamond-shaped. So this one is pretty easy as long as you remember how to spell the word, all right? So this extends from the midline occipital bone and vertebrae to the acromion and spine of the scapula. All right, this is going to elevate and depress the scapula or the shoulder blade, depending on which part of the muscle is contracting. Can also rotate the scapula superiorly and pull it back or retract the scapula. All right. Okay, so Splenius capitis. This means head patch. This is a strap-like flat muscle. It's located medial to the levator scapula, and it extends and laterally bends the neck and head and rotates the head to the same side, which I can't do very well because of my issues with my neck. That's about as far as I'll turn. Splenius capitis, all right? And so you'll see it has a very different look to me in this model here than it does here, okay? So we want to pay attention to that. It looks a little bit different in the syndaver, okay? All right, so the Splenius capitis, this one right here, remember that goes a little bit more oblique. Well, the Semispinalis, think spinal capitis, it goes more up and down, more vertical. Okay, it's going to extend the head and rotate it to the opposite side. It is found at the upper part of the back and neck and is deep and medial to the splenius. Okay, so it's deep and medial to the splenius. This is going to allow bilateral contraction, extension of the head, cervical and thoracic spine. It's going to also allow some unilateral contraction, lateral flexion of the head, cervical and thoracic spine, which is ipsilateral, and contralateral. Okay, so rotation of the head, cervical and thoracic area. All right, thoracic spine. All right, so this is the Erector spinae group of muscles, which to me is much easier to see in APR because we have to pull all of this stuff out of the way, but we will try to look at that, okay, in lab, do try to look at that. This is a group of muscles. This extends and laterally bends the trunk, neck, and head. It has basically 3 columns or groups of muscle on each side of the spine. We have the iliocostalis, which is the most lateral, so most to the side of the Erector spinae. Longissimus dorsi, which is the middle column of muscles, and then we have spinalis, which is going to be the most medial column of Erector spinae. All right, and so for the syndaver, you're going to need to lift the Latissimus dorsi in order to see them. So that's why it says reflected away, and the trapezius. So you're going to have to bend these over, and then you're going to look and you'll see it right here. Okay. All right, so this is a good illustration here of these Erector spinae group of muscles here, okay? So we have iliocostus, then you have longissimus, and then you have spinalis, okay? And then so iliocostus lumborium, that's more lumbar region. So this is a good little picture here to look at. All right, so now we're going to move more into thorax, pectoral girdle, and the abdominal wall. All right, so here is the anterior torso superficial muscles. On the syndaver, these are kind of all connected together in one like sheet-like structure, okay? All right, so let's start with the rhomboid major. We're going to look at the rhomboid major and minor. So this one here is the major. This is the minor, okay? Major, minor. So this is the greater rhombus, which is basically forms a rhomboid equilateral parallelogram. It's going to retract, elevate, and rotate the scapula inferiorly, okay? So inferiorly. All right, so here's that rhomboid minor here. Okay, I don't know why I didn't have the syndaver here, but we looked at it on the other one. It retracts, elevates, and rotates the scapula inferiorly as well. They work together. Latissimus dorsi, a very wide muscle here of the back. This does adduction, extension, and rotation of the arm. Okay, and so it's very pronounced here and easy to see. All right, so here we have the Levator scapulae, and basically that means it elevates or lifts the scapula. So it is the scapula lifter. That's what its name means, scapula lifter. So what do you think it does? Well, it lifts up the scapula. So this is going to be deep to the trapezius, kind of a strap-like. The origin is C1 to C4 on the transverse process of your vertebrae. So hopefully you learned your skeletal vertebrae. Insertion is going to be the medial border of the scapula above the spine there. The key to finding this, it is going to attach to the scapula. It looks a little bit like the splenius, but it attaches to the superior medial border of the scapula. Here we have the serratus anterior, or serratus. I say serratus, it's probably pronounced serratus actually. But this means sawtooth, and anterior means front. So this is the front sawtooth looking muscles here, and you can see them right here, okay? And then right here on this model, which we don't have this exact model, but we have one that is similar. And then here in APR, all right? And so this is going to draw the scapula forward, and the inferior ones are going to rotate the scapula superior. So it's a large fan-shaped, it kind of has that look like a sawtooth on the lateral aspects of your thorax here. These attach the ribbons of muscles to the ribs 1 through 8. Okay, so it actually attaches, the origin is going to be on the ribs, and the insertion is going to be on the vertebral border of the anterior scapula. This is another one you are probably familiar with. This is the pectoralis, and we're going to look at the pectoralis major and the pectoralis minor. And so major always means greater or larger. So this is the greater chest muscle. It flexes and adducts the arm and medially rotates the arm. It is large and fan-shaped. You can really kind of see that fan shape right here on the syndaver. Its origin is on the clavicle, sternum, and the cartilage of the first 6 ribs, and the insertion is on the intertubercular groove of the humerus. All right, so the pectoralis minor is deep to the pectoralis major. So here you can see in the syndaver, you're going to have to pick up the pectoralis major to see this pectoralis minor underneath. And so this is the lesser chest muscle. It draws the scapula forward, medial, and downward. It runs a little bit more oblique as well than the pectoralis major. I think, oh, the origin is the anterior surface of ribs 3 through 5. The insertion is the coracoid process of the scapula. All right, so here we have the transverse abdominus. So obviously it's part of the abdomen, and it is going to run transverse, so the tissues run horizontal. This is the deepest of the abdominal muscles. Is in the posterior lumbar region, travels anterior deep to the external obliques. Let's see. On the syndaver, this can be seen near the origin at the posterior lumbar region. Okay, is where you want to look. But it is going to be, you can see this little blue portion here. It's going to be kind of hard to get to. You have to pull some of these other muscles up. All right, the last section here are going to be the muscles of breathing, the external intercostals, internal intercostals, and the diaphragm. So we're not able to see the external intercostals on the syndaver very well, at least from what I can tell. It's fairly new, so we'll see. This is the outer muscle between the ribs, okay? And this keeps the intercostal space from blowing out or sucking in during respiration, which is pretty important. It's located between the ribs and extends from the inferior edge of one rib to the so the inferior edge here to the superior margin of the rib below. So it's just between the ribs. Let's see. The origin is the superior border of the rib below, and the insertion, the inferior border of the rib above. Okay, pretty easy there. All right, so here is the internal intercostal. So this is going to be more on the inside and keeps the internal intercostal space in place. All right. And lastly, here we have the diaphragm. I believe it might be on the syndaver. I know it is on the other syndaver, but I couldn't find a picture of it. And so we'll just have to look and see if it's in there. And so this pushes the abdominal viscera inferiorly, and it's directly related to breathing. If it goes down, as it pushes the abdominal viscera inferiorly, it's going to increase the volume of the thoracic cavity for inspiration, allowing air to flow in. The origin is the inferior border of the sternum, costal cartilage, and lumbar vertebrae, and insertion is the central tendon of the diaphragm. So I hope this helps. I'm going to try really hard to get the rest of the muscles done before the exam as well. So good luck.